the second time in its history, the American Red Cross is warning of a national blood supply crisis. The organization says donations have fallen to a 4-year low this summer. It's forcing them to limit distribution to U.S. hospitals, which puts patients at greater risk across the country. And they're urging you to donate now if you are able. So joining us to discuss this morning is Dr. Courtney Lawrence. She is the Divisional Chief Medical Officer with the American Red Cross. Thank you so much for joining us, Doctor. So shortages in blood supply, of course, not uncommon, but this is being described as a historic crisis. Tell us why that is.
That's correct. The American Red Cross has declared the second ever national blood crisis, which is the most extreme type of blood shortage. And it is coming into a 4-year summer low of our national blood supply. As a provider who practiced in the hospital setting during the first blood crisis in 2022, I know that this can really have profound impact on hospitals' ability to deliver effective patient care. And so it's really critical that we get the word out that we need blood donors.
Explain the sort of broader impact that this can have on healthcare here in the United States.
Absolutely. I think many people, unless they've ever needed a blood transfusion themselves, don't understand that blood transfusion is really the backbone of modern care, whether it's supporting someone who's recovering from an injury, a car accident, or someone who needs regular blood transfusions because they're fighting cancer or because they have a blood disorder. It really is what makes a critical access point to emergency care.
So what do you think is driving this downturn?
I think there's several factors. We know that summertime often presents a lot of challenges in terms of our donors because many of them are out in different areas and not presenting for their usual regular routine appointments. But also with this year, we've seen heat waves, we've seen foodborne illnesses, all things that could impact the ability of some of our donors feeling healthy and well enough to come in and donate. And between Memorial Day and Labor Day are the 100 deadliest days of the year, meaning that we're seeing more people out on the road traveling, more car accidents, more injuries that cause people to present to the hospital in need of a blood transfusion.
So for those who are interested in donating, what's the easiest way to find out where and how to go about doing just that?
Absolutely. We ask donors to check redcrossblood.org, one, to find the eligibility criteria, but two, to schedule an appointment. They can also do so by downloading the Red Cross Blood Donor app or calling 1-800-RED-CROSS. By making an appointment, it allows them to make sure they get a good night's sleep and that they're well hydrated so that their donation appointment can go quick and easy.
All right. These donations are so important. Dr. Courtney Lawrence, thank you so much.
Thank you.